Hey, I woke up today and thought I'm going to Isaman Brim community in the central region of Ghana to have a medical outreach for the people. I went there with my two nurses. The one sitting behind me is Becky. She had a talk with them on diabetes, and then the one in pink over there is Aba. She also assisted with the hepatitis B screening and vaccination.
Other health workers are open, then by assistance again. Your mom will use their water, if they have BBI and fine. But in the case, my because the mountain has that. But come on, you come to Mr. Michael. But many visit your bone via Yampa. Then what up visit your bone.
So that conversation went quite well, and then we moved on to the actual screening. We set up our logistics and was ready to act. Here is how our setup was like. There was a medication area, there was an eye screening area, there's a DJ's area, this is us, and that is the doctor's area behind there. Then there's the screening for the other conditions, then there's blood pressure area. It was such a busy day. We started slow, but everything picked up with time. I started by talking to this woman about hepatitis B, the dangers associated with not knowing your status, and if you know your status and you're negative, the implications behind that, and why it is necessary to be vaccinated as well. When she understood everything and the understanding was clear, consent was given as well, we went ahead to do the actual testing. We used the rapid tests using the Hep B surface antigen to see if there was some Hep B in her blood. When we did it, she was negative, which was good news for us and for her as well. And she received the Hep B vaccine. We scheduled her for the 3-dose vaccine. She came with her little child who was quite scared, even though she wasn't the one that was receiving the injection, and that was just a side attraction. Let's use this opportunity to talk about hepatitis B. What exactly is hepatitis B? It's a viral infection caused by the hepatitis B virus, occurs worldwide, and is usually transmitted sexually through injections or through mother to child during pregnancy or childbirth. It has an incubation period of about a month to 6 months. That's by the time you're exposed to the time you start showing symptoms, it could take about a month to 6 months. Most people do not show any symptoms, but a few people may show some mild symptoms associated with the liver, and then later it resolves completely within a few weeks or months. However, a few people and most children, especially infants who are infected through their mothers, develop chronic hepatitis, and that is why it is very important to know about this disease. This disease can cause scarring of the liver and sometimes becomes cancerous. So it is very important that we prevent hepatitis B as much as we can. Most times, hepatitis B is tested through the surface antigen, which is what we did at the screening, and thankfully most of the people were negative, and that was good news for us. Usually treatment is usually done at the hospital depending on your status, whether the patient is acutely ill or not. And then we have prophylaxis to prevent the infection from happening in the first place, and that is the recombinant vaccine that we usually give to people, and that's what we gave today as well. We also like to educate pregnant women a lot to make sure that they get their antenatal screening done so that they know their status and they are managed appropriately. So that's a little short thing about hepatitis B. Like I mentioned before, most of the people we screened today were negative, and we were quite happy about that. From the screening, the conclusion was that about a quarter of the children that were screened today had some form of malnutrition. Most of them were mild, a few of them were moderate. We found quite a few as well that had severe malnutrition. We had one child that actually had severe malnutrition with an HB of that's hemoglobin of 5.0. That is quite low for a child. We had one that had a hemoglobin of 7.0 as well. We also found a child that was not gaining enough weight. The child was 14 months old and his weight was 4.5 kilograms. Most of them tested positive for malaria. Most common chronic disease we found was hypertension, followed by diabetes mellitus. And most adults had very good hemoglobin. So that was it for today. I really enjoyed myself. It was quite fun. I laughed a lot. The people were so nice, very nice human beings over there. They're so kind people. I really enjoyed myself with the Asaman Ibrim people of the Central Region. Bye.